I'm a pediatrician, but I'm also a father to a rambunctious toddler. And when we travel, I make sure that my own first aid kit is set for anything that she may need. We also never travel without a nose Frida or a nasal suctioning device, just in case she gets congested or she has a really bad runny nose and we need to suction that out. I also make sure that we always have certain GI medications like antacids and also anti-nausea medications, because you never know when you're traveling with those planes, boats, trains, and cars when things might spin around and you may have a nauseous child.
So the wetting drops are just basically eye lubricants. So there are artificial tears. There's lots of different brands of those. Those keep your eye moist and basically supplement your regular tear production to keep the eye comfortable and moist and avoid the redness in the first place.
Well, it's so hard to travel with liquids. So when your child is old enough, which is really usually 2 and up, you can use chewables. You just have to read the package carefully for what size chewable pill you have and make sure it matches the dose that you would be giving with a liquid. And you can confirm that with your pediatrician before you travel to make sure that you have the right dose. But many kids 2 and up can handle a chewable. And I even encourage families to teach their children to swallow pills at a very young age. You can practice this with Tic Tacs and teach them the mechanics of how to swallow a pill. It just makes things a lot easier.
You know, as an allergist, my number one recommendation is actually for my patients with food allergies. For individuals with food allergies, they should carry an EpiPen. 1 in 13 children have food allergies nowadays. So whether you have food allergies or one of your children has food allergies, you need to make sure that you have your EpiPen on hand. You're going to an unfamiliar place. You're going to be eating at new restaurants. You may be eating new foods. You need to make sure that you can clearly express your food allergies and let the people know who are serving your food that you have food allergies. You need to have your EpiPen on hand in case you or your loved one with food allergies accidentally eats one of the foods that they're allergic to.
If you eat that salsa, that true authentic salsa that has a lot of tomato, you may get some heartburn. You've never had it before because you never had real salsa. Inevitably, you're going to eat something that's going to give you heartburn. You're going to want to relieve those symptoms, either Pepcid or Prilosec. How do you choose? Most people know which one works best for them. Both are available over the counter. Both are also available by prescription if you need a higher strength. But I recommend taking the over the counter with you on your vacation.